We've seen that the spinal joints form a triad with a single joint at the front of the spine, the spinal disc, and two facet joints at the back of the spine, which are formed from the inferior articular process of one vertebra and the superior articular process of the vertebra below. From the side, this creates a seesaw effect where we have a central fulcrum or pivot point represented by the facet joints, and then we have leverage forces or resistance forces in front and behind. So in front we have the spinal disc itself with its spongy nucleus and its fibrous outside casing, the annulus. And behind the pivot point we have the ligaments and muscles of the spine itself. So both of these sets of tissues will create an elastic recoil force, a resistance force, as the joints are moved. So if we move the joint into extension, the disc, the outer aspect of the disc, will be placed on stretch, and so the fibers of the annulus fibrosus, the outer casing of the disc, will be placed on stretch to limit the movement, together with the anterior longitudinal ligament which lies in front of the vertebral body. As we move into extension, those structures behind the facet joint, behind the fulcrum of the pivot model, will be relaxed. So the spinal muscles and the spinal ligaments will be shortened and will release their tension. As we move into flexion, the reverse occurs. The outer casing of the disc, the annular fibers, will be relaxed and pressure will build up in the central nuclear portion of the disc. As we move into flexion, the posterior structures, the ligaments and the muscles on the spine, will be placed on stretch. Those closer to the fulcrum will stretch less than those further away. So the facet joint capsule and the ligamentum flavum, which is formed from it, will stretch less than the interspinous and supraspinous ligaments. All of those will stretch passively, whereas the muscles will stretch passively but can also contract eccentrically in a flexed posture to limit movement. So the spinal segment acts a little bit like a seesaw, with a central pivot point and forces acting at either side of that pivot. Reminding ourselves of the anatomy of this area, we can see that either side of the vertebral bodies we have a longitudinal ligament which travels the whole length of the spine. Anterior longitudinal ligament in front of the vertebral bodies, posterior longitudinal ligament behind. And then the joint capsules, the facet joint capsules, become thickened to form the ligamentum flavum. Between the spinous processes we have the interspinous ligament. On top of the spinous processes we have the supraspinous ligament. In the resting position, the lumbar spine naturally has an inward curve called the lumbar lordosis. As we move away from this inward curve, we are flexing the lumbar spine. So flexion of the lumbar spine would by definition occur when the lumbar spine is straight, i.e. moved away from its concave position to a vertical alignment. As we go further into flexion, the curvature reverses and becomes convex. As we move into flexion, the spinal disc becomes compressed and alters its shape, while the facet joint opens up. As the facet joint opens up, it creates a gap, and that gap is increased from the normal volume of the facet joint, which is 2 millimeters of fluid. So as the facet joint opens, if we are flexed and the whole body is angled forwards, as in a toe-touching movement, the forces created will shear the upper vertebra forwards in relation to the lower vertebra. And although this amount of movement is very little, it creates a shearing force on the facet joint, while the disc undergoes a compression force. If the muscles are completely relaxed, the facet joint capsule and the ligaments themselves will limit the range of motion by approximately 40%. The other ligaments, the interspinous and supraspinous ligaments, limit less by about 20%, and the disc itself will limit by about 30%. When the muscles are active, the muscles themselves will limit movement through elastic recoil and through muscle active contraction. As the facet joints open and allow a greater amount of movement to flexion and forward shearing, we must remember that the facet joints may not be equal on both sides. So asymmetry or tropism is common in the facet joints, and it is defined as a difference between the right and left sides greater than 10%. It occurs in about a quarter of the population and is more commonly seen at the lower lumbar segments. Over a period of time, repeated flexion movements will stress one facet joint of the tropic pair more than the other. In the short term, that can lead to pain from inflammation of the facet joint, and in the long term, sometimes to degeneration of the joint. On this X-ray from Lay et al. 2018, we can see how the facet joint tropism is measured relative to the line of the spinous process. As we bend forwards into flexion from a standing position, we would naturally assume that the spinal extensor muscles contract eccentrically as we move into flexion, and as we move back up to the standing position, the spinal extensors should contract concentrically. But what we see is an obliteration of the activity of the muscle as we approach full flexion, and that is because the muscles are placed onto stretch, and we can transfer the force created by the muscle from active contraction to passive recoil. So the muscle starts to act as a giant elastic band. And this reduction in muscle activity saves us energy in terms of muscle work and is known as the flexion relaxation response. And what we can see on this EMG trace from Horn and Bishop 2013 is myoelectrical silence. In other words, no activity as we get towards the flexed position, and activity starting again as we come into our extended position. This normal activity of the flexion relaxation response is impaired in individuals with chronic low back pain. And in this tracing from Kolaka and Hendricks 2005, we can see on the left the normal flexion relaxation response as the subject moves into flexion. So we get an increase in activity at the beginning of flexion, a reduction and obliteration in activity as we move into full flexion, and we simply hang on the elastic recall of our spinal extensors, only for those muscles to become active again as we move up into extension. But on the right hand trace we can see an individual with chronic low back pain, where we see that the muscle is active throughout the full range. So in flexion, in full flexion, and coming back into extension, the muscle maintains its activity and will therefore tire more easily, will reduce its blood flow and become ischemic, and could therefore produce ischemic muscle pain. In this study by McGill 2016, we're comparing the difference between muscle and ligament changes. So remember, we said that in the normal position the lumbar spine has an inward curve, a concave curve. That is defined as the lumbar lordosis. That will vary between individuals, and we can increase or reduce the depth accordingly, and define the optimal curve as being the neutral position. As we move out of that neutral position, the concavity will become flattened. That is defined as flexion. As we go further, the concavity becomes convex. So the inward curve of the lumbar spine in neutral becomes reversed and flattened as we go initially into flexion, and then becomes an outward curve as we go further into flexion. And this study is looking at the difference between the resistance provided inactively through ligament and actively through muscle. And what we can see when we look at the muscle is that in the neutral position the muscle is more active, because in flexion there's less muscle activity because the ligaments themselves are placed on stretch. So as we go into a stretch position, we stretch the ligaments, they recoil and they provide force passively, whereas in the neutral position the same force is provided but actively through the muscles. So we can say that as we move out of a neutral position, we're changing from stress on the ligaments to stress on the muscles. And we know that the spine itself is slightly weaker in a flexed position than in a neutral position, where ligaments are concerned. So as we move away from our neutral position, we would need to compensate for that change in movement by having stronger muscles or by using those muscles more. So if we look at a weightlifter, for example, moving a very large weight in a flexed position of the lumbar spine, they're only able to do that because of their increased muscle strength. In standing, as we move into spinal extension, the facet joint is placed on compression activity, so it is impacted. The facet joints will start to move forwards. During extension, in a standing position, the facet joints move closer together. Eventually, the facet joints can impact, and when they do so, that can cause pain if the facet joint area is inflamed. In addition, the extension movement causes the intervertebral foramen to narrow, and if there is a irritability of the nerve root in that area, that can cause pain. A reduction in space around the nerve root and to a degree around the spinal cord, spinal stenosis, can be positive to an extension and rotation test. So we can reproduce the patient's symptoms through extension and rotation, known as Kemp's test, and that will be positive in cases of facet joint impaction, spinal stenosis, or to a degree spondylolisthesis. Prolonged extension movements in sport will be limited by abdominal tone, so activities such as an overhead press will be limited by abdominal tone, and the extension of the spine will occur coupled with anterior tilt of the pelvis. Rotation and lateral flexion movements occur when one facet joint opens and the opposing facet joint closes, the axis of rotation being close to the front of the vertebral body. The limitation to movement is compression of the cartilage on the closing facet joints and torsion and shear of the disc as the vertebral body of one vertebra moves relative to its neighbour below. In addition, the facet joint capsule of the opening facet joint will be placed on stretch. The lateral flexion and rotation coupling which occurs, in other words, one movement occurring with the other, varies along the lumbar spine, and broadly speaking, we can predict that different movements occur at different times. This is traditionally known as Fryet's laws, and they are not hard and fast, so they can be used for guidance, but because of articular tropism, that is one facet joint being different to the opposing facet joint on the other side of the body, because of articular tropism, these rules will not always apply. But essentially, in a neutral position, the contralateral rotation will occur. So with a left side bend, you will see right rotation. In a non-neutral position, that is either flexion or extension, you will see the movements on the same side of the body. So left side bend will be accompanied with left rotation. And in general terms, when there is more movement in one plane, there will be less when in the other plane. So when we get a greater degree of lateral flexion, less rotation is available. So when we're doing an exercise, if we bend to the side, we won't be able to turn from the lumbar spine as much as we would if we were standing up straight. So if we are doing a rotation movement in the spine, other areas of the spine would have to compensate.